So good afternoon, everyone. Thank you for having me here today to provide you with an overview of the New Jersey Division of Disability Services. My name's Diana Marone. I'm an administrator here, oversee a couple different areas of the division, and I'm thrilled to be here to talk to you about our services today. So our division, again, the New Jersey Division of Disability Services, goes by the acronym of DDS. We've been serving New Jersey residents since 1997, when we were established via governor directive as a central state focal point for cross-cutting disability issues and to really serve as a statewide hub for disability-related information. Then 2 years later in 99, the division was established by statute. We house an information and referral services unit. We administer the Personal Assistance Services Program and the Traumatic Brain Injury Fund, as well as the Inclusive Healthy Communities Grant Program. We promote NJ ABLE and NJ Workability, and we manage several initiatives focused on health and wellness. And we're going to talk about all of these things as we move forward. Our mission statement is to really ensure the needs of individuals with disabilities are represented in all areas of life, including health, education, employment, recreation, and social engagement. We really aim to build meaningful relationships with other state and local organizations and to really ensure folks with disabilities have a seat at every table and are represented, as I said, in all areas of policy and decision-making as we strive for greater access, equity, and inclusion for people with disabilities. We also work to promote the disability justice movement. We realize there's no equality without everyone. And we also recognize that people with disabilities are disproportionately affected in all areas of social determinants of health, including socioeconomic status, education and neighborhood, built environment, employment, and social networks. And so our goal is to really level the playing field for people with disabilities. So just to give you an idea of what the statistics look like in New Jersey versus nationally, you can see here on this chart that 26% of adults in the US have some type of disability, which breaks down to about 1 in 4. In New Jersey, 23%, also 1 in 4, have some type of disability. So we're fairly close to the national standard. According to the Centers for Disease Control and Prevention's Disability Health and Wellness data systems, 26% of individuals over the age of 18 in the US have some type of disability compared to 23% or 1 in 4 in New Jersey. 11.1% of individuals nationally have a mobility disability compared to 10% of individuals in New Jersey. 10.9% have a cognitive disability compared to 10% in New Jersey. And you can see the rest there on the screen. Overall, the point is that generally New Jersey ranks fairly close to the national averages in terms of different types of disabilities. As I mentioned earlier, adults with disabilities in New Jersey experience health disparities, and they're more likely to have heart disease, have diabetes, smoke, have obesity, and have depression. You can see there that people with disabilities are represented in the lighter pink color or at the bottom bar on each of the lines. And it's significantly higher than the top bar or the darker bar. So the first area of our division I'd like to talk about are our information and referral services. Through a toll-free hotline, our division connects callers with live, certified community resource specialists. And our community resource specialists are certified in aging and disability services. They're there to help you address disability-related issues and concerns, provide information, assist with problem solving, screen for various services, and refer to appropriate services and supports. Our community resource specialists also exhibit at community events where they share information and talk to folks live throughout the community. They administer the NJ ABLE program, which we'll talk a little bit more about moving forward. They initiate enrollment in Managed Long-Term Services and Supports, or MLTSS, for children and young adults ages 20 and under. And they provide screening and technical assistance for the New Jersey Workability Program. And again, we'll talk a little bit more about each of those programs and areas. What's important for you to know is that when you call our 800 number that you see there on the left, you're going to be connected with a live, trained and certified representative who can talk to you for as long as you need about whatever's going on and really screen and direct you to the appropriate service. We serve individuals with all disabilities and all ages. Our information and referral unit also publishes our comprehensive resource directory, NJ Resources, as well as a regular listserv that we call DDS Communications. So the images you see there on your screen on the left-hand side is the cover of our newly redesigned resource directory, NJ Resources. It's a comprehensive directory listing resources available throughout the state to help with varying supports and services, ranging from financial support or educational supports or advocacy or legal, a wealth of information about the services available in New Jersey. The directory is published in English and in Spanish. It's available electronically on our website at the address you see on the screen, and also in print. If you'd like to request print copies, you can email us at the email address dds.publications that you see there on the screen. I will just add that this newly updated version, which was, it's been recently updated to be made more accessible and fully accessible. The print version is not out yet, but we are anticipating that it will be available in May of 2024. So yeah, feel free to contact us to request a printed copy. We also publish a guide to accessible parking and have informational brochures about all of the programs we administer, like NJ ABLE, the Traumatic Brain Injury Fund, the Personal Assistance Services Program, and others. Additionally, we have a listserv that has approximately 5,000 subscribers and is growing. And we send dedicated information out through that listserv to our subscribers. We send information twice a week, and everything that we send is vetted. So you can be sure that when you get those messages, you're hearing the most up-to-date information about events or trainings or resources for folks with disabilities. On this slide, this is a screenshot of our website, just showing you how if you'd like to subscribe to DDS Communications to receive our e-blasts, you can do that right at the top of our website there where it says subscribe for email updates. And if you'd like to access our publications, including New Jersey resources, you can also do that by clicking on the Resources and Publications tab on our website. As I mentioned, the directory was recently updated. It includes a table of contents that allows you to click on whatever chapter you'd like to access. They're all text descriptions, and it's updated monthly, so you can be sure that whatever you're seeing in that directory is the latest information and is current. In our information and referral unit, some of our key partnerships are New Jersey 211. They serve as our after-hours INR, providing information and referral 24 hours a day, 7 days a week, 365 days per year. So should you need something or have a question or concern that falls outside of regular business hours, you can dial or text or chat with NJ211, and they have a comprehensive and searchable resource directory that you can search yourself, or they can search for you when you call. So a great resource to access any time of day. And we also have a partnership with the Centers for Independent Living. New Jersey has 12 Centers for Independent Living, or CILs, covering all 21 counties. They provide a host of core services that you see there on the screen, ranging from information and referral and advocacy and peer support. And then each of them, depending on their budget and their service area, also provide some specific services to their catchment area. So definitely would encourage you to connect with the Center for Independent Living serving your county if you are a person with a disability, to see what they have to offer. I'd like to talk about NJ ABLE now. NJ ABLE, or an ABLE account, So what is an ABLE account? You may have heard of this. An ABLE account is a tax advantage savings account allowing qualified individuals with disabilities to save for disability related expenses. DDS administers NJ ABLE through a contracted program manager called a census. We have a dedicated NJ ABLE program representative who can provide an overview of NJ ABLE, formal presentations, informational brochures, and also provide technical assistance. The beauty of NJ ABLE is that individuals with disabilities can save money for disability-related expenses while not jeopardizing their eligibility for certain assistance programs like supplemental security, income, SSI, and Medicaid. So money in the NJ ABLE account is not considered an asset, and it grows tax-free. And it can be spent on disability-related expenses, which are very broadly defined. And they include some things, but are not limited to education, housing, transportation, or personal support services. Basically anything that can support you in your life as a person with a disability can be considered a disability-related expense. There are investment options for the money, or if you prefer not to invest at all, you can just open it in a standard checking account. Accounts can be opened easily online at the web address you see on the screen, savewithable.com. And I mentioned that there are tax advantages. So we're going to talk a little bit about some of those advantages, as well as the eligibility for NJ ABLE. To be eligible, the onset of disability had to occur before age 26, and you have to either be receiving SSI or SSDI, Social Security Disability, or if you're not already receiving those benefits, you have to meet Social Security's definition criteria regarding significant functional limitations and provide a letter certifying that information from a licensed physician. So you're either receiving those benefits already, which means you've met that criteria and it's been proven that you've met that criteria, or you can provide certification that you do in fact meet that definition of disabled through the Social Security Administration. So pretty easy and simple eligibility, just those two categories there. Onset of disability before age 26 and meet that definition of Social Security's definition of having a disability. Again, the accounts can be opened online at savewithable.com. And as I mentioned, the beauty of an ABLE account is that the money grows tax-free and it's not counted as an asset for most means-based programs. So a lot of participants, a lot of constituents with disabilities are receiving either SSI or SSDI. And as we know with supplemental security income, SSI, you're limited in how much you can save in assets, something like $2,000. And so with an NJ ABLE account, you can save up to $17,000 per year and up to $305,000 in your lifetime, and that money is still disregarded. So you would maintain your eligibility for SSI and other means-based programs while still being able to save that amount of money each year. Additionally, in regard to SSI specifically, up to $100,000 in your NJ ABLE account will be disregarded. If the account reaches $100,000, a really interesting thing happens. So the cash SSI payment will stop, but the Medicaid that comes with SSI eligibility will continue, allowing you to continue receiving the benefits through that Medicaid eligibility that people with disabilities need. So, and then after that money spends down below $100,000, again, the SSI cash benefit automatically gets reinstated and the person doesn't need to reapply. So lots of advantages to having an NJ ABLE account. As I mentioned, we have a full in-depth presentation. I can say much more about this, but I definitely would encourage you to partake in that presentation when you have the opportunity so you can learn all about it. I want to talk next about our Personal Assistance Services Program, our PASP. This program is a personal care assistance program that provides up to 40 hours a week of routine non-medical personal care assistance to individuals with permanent physical disabilities, ages 18 and older, who are able to direct their own care and who are working, going to school, or volunteering in the community. This program is really intended to support individuals with physical disabilities so they can work, attend school, and participate fully in community life. The types of services that can be received through the PASP include traditional ADLs, activities of daily living, such as bathing and dressing assistance, eating and meal prep, grooming, and also instrumental activities of daily living like light housekeeping or shopping, driving, and using public transportation. The way the program works is that PASP participants receive a monthly budget to purchase services. The budget is determined based on an assessment that determines the amount of hours per week of assistance they will receive. That those hours are converted to a budget. The individual then creates their spending plan or their cash management plan in coordination with a county coordinator that will help them determine, which services they want, who they want to hire, how much they'd like to pay those individuals, how many hours that person will work for them. And as I mentioned, it's a self-directed program. So the person with a disability, the participant, is the person in charge of developing that cash management plan. They can really tailor the services to meet their own needs and schedules. In order to be eligible for PASP, an individual has to be a New Jersey resident, aged 18 or older, and living in the community, has to have a permanent physical disability and require assistance with at least one activity of daily living. The person must be capable of self-directing and supervising their own services. You're not allowed to have an authorized representative in this program. And the person must be engaged in a qualifying program activity, either employment, a vocational rehab or preparing for employment, engaged in school or higher education, or actively volunteering in the community. And finally, individuals must be ineligible for Medicaid or ineligible to receive personal care services through other means. To apply for the Personal Assistance Services Program, I mentioned that we administer this program in conjunction with county offices. So folks in the community would contact their designated county coordinator who could screen them for eligibility, process the application, and support them once they're enrolled in the program. There's also a fiscal intermediary organization that will help the participant handle the aspects of becoming an employer and hiring employees and file taxes and things related to being an employer in New Jersey. Next, we're going to talk about New Jersey workability. New Jersey workability is basically a pathway to Medicaid. The program creates Medicaid eligibility for people with permanent disabilities who are employed and who may be over income limits to be eligible for Medicaid through other traditional means. Here at DDS, our community resource specialists can screen applicants for potential eligibility for New Jersey workability. In order to be eligible for this program, as of April 1st, 2023, an individual has to be at least 16 years old, a New Jersey resident, determined as disabled either by the Social Security Administration or by the medical review team at the Division of Medical Assistance and Health Services at time of application for the benefit. And the individual has to meet unearned and earned, income thresholds described below. So there have been some recent changes to the eligibility criteria. Those were rolled out in phase 1 of the New Jersey workability change. And as I mentioned, that went into effect in April 1st. And so since that time, it removed the upper age limit on eligibility criteria. So there is no upper age limit. You just have to be 16 years or older. It removed spousal deeming requirements. So if your spouse has income, their income is no longer deemed to yours and counted as part of your income when you apply. It also is free from asset limits as of April 1st. And it is also available to enrolled members for 12 months after a job loss that happens through no fault of their own. And that's really huge. You know, one of the concerns that people with disabilities had expressed to us prior to this change was that they were concerned about applying for Medicaid through New Jersey Workability because their employment may change. And prior to this change in April 1st, if you lost employment at the beginning of April, let's say, your Medicaid benefit would also terminate at the end of that month. But now you have up to 12 months to secure another job and still maintain your Medicaid benefits during that period of time. So it's really a great asset. I won't go through all the specifics about the income thresholds, but you can see there on the screen that there are unearned income criteria that have to be met. Which for a single person is less than $1,215 per month, and earned income of less than $73,932 per year, or $6,161 per month. So this really allows people with disabilities to earn significant amounts of money and still qualify for Medicaid because they need Medicaid to help get them to that job that they are doing. So Medicaid can provide the personal care assistance, for example, to help get them up and out of the house in the morning, can provide access to personal care assistance benefits and help them with medical transportation. So it's an important benefit, and this program really opens the doors to allow people with disabilities to go ahead and continue earning, take the promotion, don't limit the hours you work as much as you can and as much as you're able, but still qualify for the Medicaid that you need. You can apply for New Jersey Workability online via the link you see below, njfc.force.com. But if you have questions or if you'd like to be informally screened to see if you might be eligible, go ahead and give our community resource specialists a call. Next, I'd like to talk about Disability Benefits 101, or DB 101. This is a really helpful website that provides tools and information about health coverage, benefits, and employment that can be used by people with disabilities so you can understand how these things work together. It not only provides information about the various benefit programs that exist and their rules around work, but it also provides really helpful benefits estimators that will help you, that will provide you with individually tailored results so that you can plan and set goals for work. And those results are based on the information that you put in regarding the benefits you receive, the amounts you receive, your earnings. And it's really just a website with helpful information, answers to frequently asked questions, and access to local experts to help folks with disabilities understand the benefit of working, the caveats of health insurance and how they'll be impacted with your earnings, and to really help set your mind at ease to let you know that you can and should take that job, work as many hours, earn as much as possible, because there are benefits that are going to be able to support you. Even if what you're living on now change, there are still ways to make that work and still meet your needs. NJDB 101 is accessed online at the website you see there on the screen, nj.db101.org. And I'm going to show you on the next screen just a little example of how this website can be useful. So I talked about the benefits and work estimator, and what that does is it's going to ask a couple of questions and prompt users to explore scenarios that match real life situations. So based on your answers to the specific questions, the calculator is going to show you results in the form of a chart, a timeline, and a monthly breakdown that will show you anticipated changes in income and healthcare over a 5-year period. So you can take a look at this chart on the left. You see that today, this individual is earning $903 in SSDI, or I'll say has income of $903, which is comprised of a combination of SSDI and SSI. In 6 months from now, you see the green bar represents the individual's work income, and the orange represents the SSDI. So what we can deduce from that is that this individual has since lost their SSI because they began working and earning money. And so their income now consists of SSDI and work income. So what's important to note here? It's important to note that their earnings are much more than they were before, their income, let's say. So we're $2,214 in 6 months, whereas they were at $903 initially. And, the next question is, well, they've lost SSI though. That means they've lost that check that comes with SSI, and they've lost their Medicaid. So correct, they have lost the monthly stipend that they were getting from SSI. But again, they're making well more than they were getting through SSI anyway. And as we just learned on the previous slide, now that they're working, they can get Medicaid through the New Jersey Workability Program. So they no longer need SSI to qualify for that benefit. And then you'll see 2 years down the line what has happened. So that green bar, the orange bar has fully disappeared and the green bar remains. So what that tells me is that the individual has also lost their SSDI. So that means they have worked through the work incentives, through the Social Security Disability Administration, and it was determined that they're working and able to earn gainful employment. And so their SSDI benefit was stopped. Okay, don't panic. What you see is, again, initially they were earning $903. In 6 months, $2,214. And 2 years later, with no benefits, with just their work, they are earning $1,914. And their Medicaid would have been reinstated through the New Jersey Workability Program. And while they lost their SSDI because they've exhausted their work incentives, should their disability interfere with that ability to continue earning at that level or earning gainful employment, they can automatically be reinstated without having to reapply for SSDI again in the future. So this is a really helpful tool to help folks understand how working will impact your benefits and to help ease that fear behind losing benefits that many people with disabilities have. The next program I'd like to talk about is our New Jersey Traumatic Brain Injury Fund. This is a program that we administer directly in conjunction with case managers throughout the state. The Traumatic Brain Injury Fund purchases supports and services for New Jersey residents who have sustained a traumatic brain injury in the form of a strike or blow to the head. The fund purchases the services folks need to live as independently as possible in the community when other resources and public programs are unavailable to meet those needs. The TBI Fund has an annual operational budget of approximately $3.1 million. Which is actually funded by the 50-cent surcharge on every motor vehicle registration. So good for you to know when you renew your registration, you'll see that whatever that amount is, it's followed by 50 cents. And you know that that 50 cents is going directly to fund this traumatic brain injury fund. We currently have approximately 700 active clients receiving services through the fund. So let's talk about eligibility. In order to be eligible for the fund, an individual has to have a medically documented traumatic brain injury. As I mentioned, this is defined as an injury to the brain caused by a blow or jolt to the head, or a penetrating head injury or neurotrauma that disrupts normal brain function, Acquired brain injury is not considered in this definition. So congenital or degenerative disorders would not qualify as a traumatic brain injury per this definition. The individual has to be a New Jersey resident and has to have liquid assets of less than $100,000, excluding the primary house, primary car, and retirement or savings accounts. And that's really it in terms of eligibility. The annual funding limit per client is up to $15,000 annually, with up to $100,000 in lifetime funds. And some of the services that can be purchased with that budget include things like case management and service coordination, various different therapies like PT, OT, and speech, neurological care, assistive technology, medical equipment, home or vehicle modifications. The fund has lots of flexibility to consider various services and supports. They get submitted through a plan through the case manager, and they get reviewed by a review committee who determines if they meet regulation and if they're able to be approved and at what amount and for how long. Through the Traumatic Brain Injury Fund, we also work with the Brain Injury Alliance of New Jersey. They're the primary nonprofit organization in New Jersey that provide information, education, advocacy, and support for individuals with brain injury and their families. And we also have recently received a grant through the Administration for Community Living, through which we're working to enhance access to equitable and high quality evidence-based services and supports for individuals with traumatic brain injury. So we're really proud of the work in that area. Another focus of our division is on disability health and wellness. In that area, we work to promote healthy living and prevent secondary chronic health conditions among people with disabilities. I mentioned early on that we know that individuals with disabilities are significantly more likely to have obesity, to smoke, have heart disease, and have diabetes. And so through our disability health and wellness initiatives, we collaborate with policymakers, health educators, public and private agencies, and experts in the field of health and wellness to promote healthy living and prevention of secondary conditions for people with disabilities. Another focus of our division is to create more inclusive communities. In our latest, or I would say newest program, known as the Inclusive Healthy Communities Grant Program, we've been administering grants throughout the state to advance efforts that result in tangible and sustainable transformation of policies, practice, systems, and environmental conditions to ensure that people with disabilities equitably benefit from efforts to build healthy communities. We're really proud of the work of our Inclusive Healthy Communities Grant Program, or IHC, as we call it. It's an annual competitive grant program we launched during the pandemic in January of 2021. We started with an initial budget of $1.6 million, which has been increased to $2 million for fiscal year 24. And the program is really designed to be innovative in that it focuses on policy, systems, and environmental change with a commitment to address the social determinants of health and conditions that allow us to lead healthy lives, and a foundation built on the concepts of disability justice. We really encourage our partners to involve people with disabilities in their planning efforts as they promote and create healthy communities addressing the social determinants of health. We ask them to plan sustainable strategies that improve health and well-being of people with disabilities. And we're looking for them to implement initiatives that result in policy, systems, and environmental changes. We've been providing funding to local government and nonprofit organizations to undertake various initiatives to support health and well-being of individuals in disabilities in the communities where they work, live, and play. It's a little bit hard to see on this slide, but the symbols on the left represent our grantees. So you can see that we have grantees doing work in most counties throughout the state, and work is being done around areas of civic engagement, access to nature or culture, the arts and recreation, women's reproductive health, access to healthy food, educational opportunities, and healthcare, and so much more. Each time we have an opportunity to award additional grant monies, we learn about new and different initiatives going on at the local level, and we are just so proud to be able to support them to ensure that people with disabilities have access and are included in all areas of life. So if you'd like to learn more about our Inclusive Healthy Communities grant program, I would invite you to bookmark our IHC website, inclusivehealthycommunities.org, on your computer. You can sign up for our IHC Constant Contact, which is a listserv specifically related to that program, or you can join the new IHC Facebook group at the URL you see there, facebook.com/groups/inclusivehealthycommunities. And that concludes my overview of the services provided by the New Jersey Division of Disability Services. Again, if I can be of assistance, you can reach me at the email below, diana.marone@dhs.nj.gov, or you can contact one of our qualified community resource specialists at 1-888-285-3036, or visit our website online at www.nj.gov/humanservices/DDS. Thank you so much.